human beings, and he happens to be another person, another male of color, that it has hit exceptionally hard. What I'd like to do is I'd like to take a couple of seconds and have a moment of silence for Kerry, and let's pray for his speedy recovery. And he is right now at the hospital giving them the what for to let him out of there.
That's right.
So I'm pretty sure he'll be okay. So if we can kind of bow our heads for a minute and thank you. Again, welcome again. This discussion tonight will be very, very eventful for those of you that just came in the room. I'm your host, Eric Stewart. I'm replacing Kerry Whitfield tonight, but I also serve as the board chair for the Community Partners Board for Bronson Battle Creek. And so, this subject matter is something that Bronson Battle Creek and Bronson as a network has been working on. And it's very near and dear to my heart. What I'd like to do at this time is introduce our panel. We have a very exciting panel tonight, some of which I know, some of which I don't know. But first on my list would have been, and on your flyers, the president and CEO of Bill Manns of Bronson Healthcare is not here tonight, but in his place is Dr. Aaron Lane Davies. Dr. Davies and I have been in many meetings around this subject, and he is what I would call a consummate subject matter expert when it comes to these topics tonight. We also have with us Dr. William Nettleton, Medical Director of Calhoun County Public Health Department. And Dr. Nettleton, thank you very much. He comes from an organization that runs one of the best vaccine clinics I've seen to date. I was happy to get both of my shots there, and you want to talk about in and out in 30 minutes. There's some restaurants that can't do that. So I appreciate your attendance here tonight. Dr. Phillips is with us this evening, and she hails us from Oaklawn Medical Group. I'm excited to meet her for the first time, and she is properly wearing her mask because she is still in clinic. So she'll be with us for as long as she can, because she took a Hippocratic oath to make sure that her patients come first. So I appreciate the work that you're doing, doctor, and welcome. I also have Melissa Bishop Murray, Senior Director at Pfizer. And if you need to know what contributions Pfizer has made, I don't know where you've been. So it's wonderful to see you here with us tonight, and it's a pleasure meeting you for the first time, and hopefully this is not the last time you and I are in a room together. And then last but not least, one of my favorite reverends for over 20 years, Reverend William Wine, Senior Pastor at Second Missionary Baptist Church right here in Battle Creek. And like I said, we have an exciting panel, and replacing Kerry on the panel tonight will be Carla Fales, and she has the name of Kerry Whitfield in her box with a whole bunch of other things. So if you don't know who you're looking for, that's who it is. So I think we want to start tonight with an address, a special address from Lieutenant Governor Garland Gilchrist. If we can key that up.
Hello and good evening. Before I begin, I want to recognize a special Michigander who is truly one of our state's heroes in helping his community to persevere through this pandemic. NAACP Battle Creek President, Kerry Whitfield. Throughout this past year, Kerry and the NAACP Battle Creek chapter have delivered more than $40,000 worth of groceries to Calhoun County families, senior citizens, people with disabilities, and residents of underserved communities. He and his team have accomplished this amazing work, even while Kerry contracted COVID-19 himself and nearly died from the virus. There is no greater COVID-19 ambassador than Kerry Whitfield when it comes to sharing his story and encouraging all Michiganders, especially people of color, to get vaccinated. President Whitfield, on behalf of Governor Whitmer and myself, thank you for your service and leadership. Throughout this pandemic, we have seen everyone come together, from businesses to communities to neighbors to families. Our Vac to Normal campaign that Governor Whitmer and I recently launched is a great example of how we can work together to reach our highest goals. in order to reach community-wide immunity that can protect others who cannot get vaccinated, at least 70% of Americans need to get the COVID-19 vaccine. Already, more than 4 million Michiganders have received at least their first dose of the safe, effective COVID-19 vaccine. In Calhoun County, 52% of residents aged 16 and up have received at least one dose, and 44% are fully vaccinated. That is tremendous. Can we do better? Of course we can, and we are working to do so. State government alone cannot tackle the pandemic and get people vaccinated. That is why I am so grateful for the partnerships with organizations like the NAACP chapters in Battle Creek that are helping us to achieve Michigan's goals for getting shots in arms. Together, we can, we must, and we will do better at increasing COVID-19 vaccination rates, particularly in the city of Battle Creek and in underserved communities throughout Michigan. Our best messengers in the Black and Brown communities are the people who live in these communities, talking to each other. So we are asking everybody to be a COVID-19 vaccination influencer. The most effective way to encourage vaccinations is by asking your family, your friends, your neighbors, and your coworkers to do 3 simple things. Register to get vaccinated or go to a walk-up site where appointments are not necessary. Get vaccinated and then tell your family, friends, and neighbors and coworkers you got vaccinated and that they need to do so also. I continue to have conversations every day with family, friends, and neighbors about each of the 3 safe, effective vaccines. People have questions, and that's okay. Those questions have answers. We're doing everything we can to make sure that people get those answers from people and resources that they trust. Our partnerships with organizations like the NAACP allow us to distribute these vaccines in Michigan equitably and fairly. In addition, the Protect Michigan Commission, which I am honored and humbled to serve on as chair, is a critical part of this effort. This commission comprises of a diverse group of leaders from across Michigan, including NAACP chapters across the state. We are working hard to ensure that every Michigan resident has the most up-to-date information on the COVID-19 vaccine and how to access and get vaccinated. The commission is focused on protecting Michigan residents' health and safety by educating communities about the effectiveness of all 3 approved vaccines to eradicate the spread of this coronavirus. We are working and addressing, eliminating disparities in vaccine uptake, building upon the work that the Racial Disparities Task Force has been leading for the past 12 months. To everyone watching at home today, I want you to keep standing tall for Calhoun County and the entire state of Michigan. Together, we will overcome COVID-19. Overcoming is what we do as Michiganders. Whether you live in Detroit like me, or if you live in Battle Creek, we see obstacles and we overcome them. We see challenges, we overcome them. We invent, we innovate, and we overcome. Michigan's vaccination campaign is truly a testament to how we all come together for the common good and make things happen in real time. Thank you. And please keep up the good work that we are seeing from NAACP chapters in Battle Creek.
Thank you very much. We appreciate that message from the Lieutenant Governor, and it was nice of the administration to allow that to happen this evening. What I'd like to do is I'd like to transition a little bit. One thing I want to make perfectly clear is that, and we don't address this enough. This is a collaboration between Calhoun County. And in Calhoun County, we have an NAACP chapter in Battle Creek, and we have one in Albion. And Albion has been instrumental in not only putting this event on, but supporting the vaccination efforts countywide. I'd like to quickly introduce Bob Dunklin, president of the Albion NAACP, who has joined us this evening to say a couple of words. Bob?
Thank you. I'd just like to say thank all of the participants thank our panel this afternoon for being a part of this great work that is about to take place uh, throughout this county and throughout a city of Albion. There are yet people who sometimes are hesitant about taking the vaccination. And I hope after this discussion, some of those hesitation, all of those hesitation, will be removed. I think it is important that we all get vaccinated. Thank you, and let's have a great discussion.
Thank you, President Dunklin. It's a pleasure to be in the room with you this evening, and thank you for your great words. I'll start off by stating that what may be the obvious. Today's announcement was rather interesting from the CDC in terms of mask wearing. And although that wasn't on the agenda, I think that we need to bring that forth as well, because that's pertinent to the discussion and people's thought process as they look at, am I at risk or not? And, many people I talk to believe that a full vaccination means immunity or some type of superpower. And those of us in the medical community know that that's not the case. So I'll open this up to the panel. And if Dr. Phillips could get us started, the first question is, in the light of the mask piece, why get the vaccine and how does it help others when we do that?
You all didn't hear me because I was on mute. I said, "Oh mercy!" Right? I just came out of a conversation with some members of our administration about this very reality. Our organization has, in light of that information, not changed their policies and protocols, and so we in this medical space, who are very aware of the still pressing risk, are still practicing the initial guidelines that were recommended and encouraging our patients that we're serving in this space to do it, which is why you hear me talking to you right now through a mask, because I am still at my place of employment. For me, that shift and recommendations really sounded an alarm in my clinical mind, heart, and soul, to say that it is even more important for us to immediately move towards the process of trying to get any and everybody vaccinated, because the risk is now, of course, being amplified, because the press in the hearts of humanity for so long has been to be liberated, if you will, from this mass process. And so there are many who won't need any more ammunition to not wear one. And of course, we know what happens when individuals are no longer masked. The risk of exposure exponentially increases. And for those of us who have served in this space for over a year now, we know that there is not a red bullseye on people's heads for those who are carrying the virus. We have patients who are asymptomatic or who have no symptoms that are carriers that are transmitting it. And so really the press, the push, the urgency has been amplified in the hearts of those who are serving in this space. And so, yes, get the vaccine ASAP, in agreement with the NAACP, right, in this process.
You're on mute there, Mr. Stewart. You're still on mute there, Mr. Stewart.
I always have trouble with that mute. It's been a year and a half now, and so forgive me. I want to switch to you, Dr. Davies, staying on the clinical side of things, and I know that this area has suffered with, especially the Bronson region, has suffered with a high bed count when it comes to the vaccine, and it's very scary. And those of us that unfortunately have had to go to the hospital for one reason or another have maybe had long waits, but you have to be patient. Dr. Davies, can you address that piece from a clinical perspective in terms of, why get the vaccine, and does it help others with, the hospital throughput and things of that nature?
Thanks, Eric. So, the vaccine, as Dr. Phillips, elevated, is really the best way for us to protect ourselves, but at least as importantly is to protect our families and our community. And so, when you take that vaccine, it's important for you, but it's important for for those people that you love and for everybody else who is in our communities. And from a hospital perspective, we've seen tremendous impact and the power of these vaccines. And so when I looked at all of the hospital admissions that we've had in the Bronson system since the beginning of the year, since January of 2021, a tiny portion of those folks have been vaccinated. Your risk of being hospitalized after you've been fully vaccinated is approximately 2% compared to 98% if you've not received the vaccination. So it is a powerful tool to protect individuals from being in the hospital. It's a powerful tool to keep you from dying from this virus and to protect those that you live with and who are members of our community.
Great, thank you very much. That lends to the discussion too, and Reverend Wine, I want to pivot to you real quick. We hear what the clinical side is saying, but then you still have people on the street, and you, as far as I'm concerned, you're a guy that's in the mix of everything, from the pulpit to the streets, and so you're probably hearing it all. And when you hear folks saying, you know what, I'm not going down to the hospital, I'm not getting vaccinated, and it's not going to affect me. What is it that you say to those folks? Agree or disagree when you hear that speak in your area?
Well, one of the things I initially did was to encourage people to look at the options. And the options were that for me to get vaccinated, it was better than the options of not getting vaccinated. Because at that time, you must remember, I was in the hospital as a chaplain. I'm a chaplain at the hospital on staff at Bronson. So I've been in the hospital since March, and I literally saw what COVID was doing firsthand. And so I went back to my congregation and said, I'm getting the vaccination because I wanted my community to know that I felt perfectly comfortable. I trusted the science, and I thought that the vaccination was a better option than not getting vaccinated. I go back to what King said. It would be crazy to think that it would be superstition, not faith, to think that God was going to do everything for us. And so while we might have been praying about this whole process, I think we had to participate in the scientific process in order to reach the herd community so that we could protect ourselves and protect those who are around us. So my position has always been, I'm going to take the options of being vaccinated versus not being vaccinated.
Absolutely. You sound like me. I've had a couple of friends that, and we'll pivot here, that have ended up with seemingly lifelong effects. And I had
Right.
one of them that has some of those effects asked me if I was going to take the vaccine. And I said, if it's between taking the chances with that in my arm or ended up with a stutter, I'll take my chance with the arm. And sometimes we need to have those real conversations with folks in our community, just to get them to move off of that spot, because these sound bites kind of get in the way.
Sure.
Dr. Nettleton, you close to ground zero at the distribution point. And typically you have folks that walk through your doors that are prepared to get the vaccination, but then you got some that are scared to death in that environment. What do you say to those folks, and how do you nurture that calm in that environment when folks know it may be the right thing to do, but then when you get to ground zero, it's a different story?
Thank you for the question. So I'll share a personal story, a personal clinical story. But before I do, I want to back up to that kind of initial question you had about the CDC, because I know that question is a lot on people's mind. Because I know it must seem frustrating. A lot of times in local public health, we feel that too, when it feels like things change over time, and why that is, like every single day. And part of that is that this is new. And so it takes time for scientists to learn and new evidence emerges every day. And that's part of the scientific process. That's part of what doctors do, is assimilate that new information and then make recommendations, both for individuals and also for populations. So I assume why the CDC made the change today was for several reasons. So one, when the first clinical trials came out, it's about something called efficacy, how well the vaccines work in those who went through the clinical trials. And we learned these vaccines are very, very good. Then the next step is how things work in the real world. So now these vaccines have been in the real world and been received by hundreds of millions of people. And we know in the real world, outside of controlled clinical trials, they also work very, very well too. We also have new evidence that these vaccines are effective against the variants as well. That was an outstanding unknown question for a while. Studies out of Israel, the United States, the United Kingdom show that these vaccines are also effective against the predominant variants or different types of virus in the community as well. And we know now that more people are immune to the virus since more people have been vaccinated. And to be clear, fully vaccinated means 2 weeks after your final dose of your COVID-19 vaccine. The last reason is that this also demonstrates to the community and to the nation that these vaccines work. So these are my assumptions on why the communication was made today about that change on a national level for when you are fully vaccinated, that you no longer need to wear your mask in indoors and outdoor places. As a reminder, however, as of 7/24 on May 13th of 2021, there is still an epidemic order and mask order in the state of Michigan as well. So I anticipate there'll be changes and modifications on the state level as well. And of course, as was pointed out, there are some nuances there for continuing to wear masks for those who have lower immune systems and for those of us who work in healthcare settings as well. Now, to your question, Mr. Stewart, I'll share a very personal clinical story about just how we can help address this idea of vaccine hesitancy. And so I happened to be rounding in the hospital and had the privilege of rounding on folks who had COVID-19 at the peak of our recent surge. And I had a patient who had a lower immune system and had actually gotten 1 dose of the vaccine. But not enough time had gone by for the vaccine to be effective yet, and they had a lower immune system, so they still got COVID. And in fact, I was meeting with the mother and daughter of this patient, and the patient was dying of COVID in front of her mother and daughter. But it was the perception of the family that the vaccine had caused their mother to actually get COVID. So in that moment of vulnerability of that family, you know, and in their grace, they allowed me to provide some additional education that no, this was not because of the vaccine. This was because the mom had been exposed to the virus. She had a lower immune system. Not enough time had gone by, and that's why she had gotten sick. That generated understanding within their family and understanding for them too to also be vaccinated, because at that point they were very reluctant to get vaccinated. So even in those most vulnerable of settings, moving forward, it's going to be these very personal one-on-one conversations with your doctor, one-on-one conversations with your family, one-on-one conversations with your pastor about these decisions to both protect you as an individual and you as your family. I mean, it really is that next step to getting back to normal. But those are the next steps, I think, moving forward to address this issue.
Thank you very much, Dr. Nettleton. And that has a great points. Melissa, I would like to transition to you, being from Pfizer. This is pretty timely in terms of a production type thing. Can you address the question we were prepared for about one, does Pfizer see the overall need slowing down just because so many people have been vaccinated and what have you, if you can address that? And I think the question on the table is, and you're the best person to answer that, is how safe is it for everyone? And how do we know?
Thank you, Eric. So in terms of production, we are so grateful for the state of Michigan because, as you know, the vaccine is manufactured and produced in Michigan. So kudos to Michigan for that. In terms of slowing down, there are surges going on all over the world. As you know, the way that it works is Pfizer sells our vaccine to governments. So the governments put in orders for the vaccine. And so we continue to see orders for the vaccine from all parts of the world, because just because the US has had a better uptake in the vaccine and vaccinations, there's still many parts of the world that have not have access to vaccine. So unfortunately, what I would say, Eric, is we are not seeing a slowdown at all. And then there's the possibility of a booster shot next year. So we're here to meet that challenge. Pfizer is we just have a tremendous workforce in Michigan they're doing Herculean work, but we don't see a slowdown. In terms of your other question, do you mind repeating it? Your second question?
I think you addressed the piece of how safe is it for everyone?
Yeah, it in our clinical trials, we showed safety and efficacy. I think Dr. Nettleton really did a great job addressing the safety and efficacy of it. And what in our clinical trials, we showed 95% efficacy. What we're seeing in the real world, as Dr. Nettleton has mentioned, is that the Pfizer vaccine is very safe, very efficacious. What I would say to those who are listening, whether it be Facebook Live or Zoom, please, if you have any hesitancy, talk with somebody, get the facts so that you can make an informed decision. We don't want to see a surge and multiple surges. We don't need to see another person die from COVID-19 when there's something that will protect you from it. So thank you for the opportunity to share that.
You know what? I'm a purveyor of common sense, and part of that is when you ask for help, ask somebody who can help you.
Exactly. Right.
There's plenty of people to ask.
Absolutely. And so I think it's really important. I'm so glad to see the faith-based community engage in this, because they are such trusted voices in the community. I know people are scared. I know that they're concerned about vaccinations. We can't ignore that, right? But let's get the information. And so this is a really great opportunity for the real information, the correct information to get out. So I'm just happy to be here to share this information with your audience.
Thank you very much, Melissa. Now that ends the softball questions, and this is for any of the panelists, okay? And because I think that this is real important for us to discuss as human beings. But one of our main questions is, why is the vaccine even more important for people of color? You hear so many people talking about, well, anybody can catch it, and we all can get vaccinated, but and the statistics, and Dr. Davies and I talk about this all the time, the statistics are lopsided. So why is it so important for us to be inclusive of people of color, and why is it even more important for that group? Any of you?
Well, I'll start, and I hope others will follow. Certainly, when we're looking at minority groups, and so I'm talking about Blacks and Hispanics, that we are, it's not that we're more susceptible to the COVID-19 virus, is that we're in situations where we are having to go out more often. So We may have jobs that require us to take public transportation. We may live in a setting where multi-generational families, so that we're passing it along to grandma and to our older relatives. So what I would say to why it's so important is because we are in situations that make us more susceptible to be exposed to COVID-19. And then we also have to think about healthcare disparities. So when you think about the healthcare disparities that some Black and Brown people suffer from, it has an impact on the susceptibility. So I think that for all those reasons, and then if you're a runner and you're out there, you still can catch COVID-19. So it doesn't matter if you have this really great health or you have healthcare disparities, you still can catch COVID-19. But the fact is, we do have something to help you prevent you from catching COVID-19.
Thank you, Dr. Phillips, and then I'll pivot to you, Dr. Davies.
Yeah, thank you for that important, necessary question. And so we, for those of us who've been listening and engaged in the conversation, we are aware of the disproportionate impact. You said it, lopsided. But the part of my heart that resonates is honestly related to what I do every day, which is trying to create a safe space for people to have the conversation, to ask the questions that they are pondering, but don't have the right environment or the right resource to ask that can give them the facts and the truth, but also the grace that they need. Because sometimes people don't even know what to ask. They just know how they feel. They know that they're scared of the virus, but they're also scared of what they're hearing on social media and YouTube about the vaccine, right? And so we hear all of these sound bites that say, talk to your physician. But the reality is that our brown and Black families sometimes don't have that relationship. They don't have connections with the family practice provider because they're not connected in that way, whether they have insurance or not. And so we undermine this concept of access to such a strong degree that it really perpetuates this negative cycle. And so I'm so grateful for these opportunities because it's really hopefully striving to meet people where they are, right? I look for opportunities that wherever I'm found, whether it be in the church or unfortunately sometimes in the grocery store, because I live where I serve, right? Where people are seeking answers to questions about what is best for them. Because I think when people are hesitant, it's not because they're hesitant because they want to harm themselves. It's hesitant because they don't know. And right now in these moments, what they do know or what they do think they know is speaking louder than what they know. And so these opportunities to gather together the voices of people who are working every day to earn the trust of the populations that we serve, to make ourselves available, to have those one-on-one conversations, because that's really where the difference happens. In the space where I serve, in every room, there's a bright pink sign that says, "Did you get your COVID vaccine?" And since we put those signs up about a month and a half ago, almost every other visit, the patients who have gotten vaccinated saying, "Dr. Phillips, I already got my vaccine." I'm like, yes, elbow high five, right? And the patients who haven't, but who have been wrestling with that decision, because again, yes, there are some who are just clear, I'm not doing it, I'm never going to do it, ain't nothing you can say that's going to change that. But there have been so many who've been wrestling with this decision, are grateful for a moment to just say, I'm thinking about it. This is how I feel about it. Tell me what you know about it. And so if we can just continue to do what's being said, be present. If you got your shot, you don't have to know all the facts. You don't have to know all the statistics. Share your experience. Tell somebody in your life circle that you got it and you still alive. You got it. You still breathing. You got it. Your arm's still on your body. You got it and you ain't a zombie. I have heard it all. So just literally tell your story. Tell somebody that you got it and you're fine, and encourage somebody else to do the same.
Thank you very much. Dr. Davies, you want to chime in?
Thank you. It's Dr. Phillips is a hard act to follow. So So a couple of comments, and I would share that I personally got the vaccine on the first day that it was available to me. I encourage my children to get the shot. I encourage my parents and everybody in my life to get the vaccine as soon as they were able. Eric alluded to, and several others have spoken to, the disparities that we've seen. We know that Black Americans have died at a rate of nearly twice that of white Americans from COVID-19. But Calhoun County is special, and it's special because of these kinds of conversations. So we do not see that same disparity. Your risk of dying of COVID-19 being Black or white in Calhoun County is roughly equal. And that's because of these conversations. It's because of our ongoing efforts and the efforts of this group of people to continue to tell that story. I had the privilege and honor of speaking with Governor Whitmer earlier this week, and she asked me, well, why is Southwest Michigan different? Why are Calhoun and Kalamazoo counties different? And the answer I gave her, it was because of the relationships we've built before COVID and the relationships that we continue to build as we talk about the value that this has. And I made the point that this is not a one conversation opportunity, right? We have to build relationships with one another. We have to have this conversation again and again. We have to build the trust so that we know who in our community has the information and is able to provide that in a way that is accessible to every member of our community.
You're on mute there, Mr. Stewart.
There we go. One thing I want to cover next, and I was pivoting to Pastor Wine, but a pastor's job is never done. One thing I want to pivot to next is the side effects issue. And I've had several friends. I alluded to a friend of mine now has a stutter, and he told me this week he had some eyesight issues, and I've heard all types of things. We want to discuss maybe what does the side effects really mean, and from a clinical perspective, are we prepared to handle that? How do you have somebody that has been affected by COVID? We've never had to deal with those types of side effects, in my opinion, that have had an origin of a disease like this, if you will.
So
forgive my non-clinical explanation, but I'm interested to have that conversation.
Eric, I want to make clear you're talking about side effects from COVID-19 disease as opposed to the vaccine.
Yes, ma'am.
Yes.
yes, ma'am, from Pfizer.
We're not talking about the vaccine.
Yes, if I alluded to the vaccine being the root cause, I misspoke. I meant COVID-19 itself and some of the side effects. And one thing I'll allude to is, you remember I talked about our esteemed friend, Kerry Whitfield, is kind of he's been going through it. So just because he came out of the hospital, he still has lingering effects that are surfacing and that have maybe put him back in that same hospital. So are we prepared to address those things, and are there any things that we need to have be keen on as we approach that from a clinical perspective? That's up in the air for whoever's not on mute. Dr. Nettleton, you want to take that?
Sure. I think this is a natural. I think just to bring up the risks and benefits of the vaccine as well. I think that's where this conversation can be helpful. And let's talk about that too. And so this virus is never been in the human population before. And so again, we're still learning more about it over time. So there's this condition called long haul COVID, which is defined as these symptoms that come up of more than 4 weeks after you've recovered from the disease itself, or if you haven't recovered, it's prolonged. And we're still learning a lot about this condition. And this may be, fatigue, feeling tired, continued prolonged cough or out of breath. Some people have a prolonged sense of loss of smell as well. So we're still learning about, why this is. And just like everything else in this pandemic, we're going to be learning more about that. And it is another reason to get the vaccine. And we think about that particularly in folks who are not older or have underlying medical conditions, about thinking about, what is the risk for that population to have long haul COVID, for example. So you think about, sometimes when we first had this conversation, particularly back in December and January, about the side effects of the vaccine. So let's talk about that in terms of the risk benefit of the disease itself, even if you are a younger person who don't have underlying medical conditions. So it's expected to have a sore arm or a headache or feeling tired, or even chills after you receive your dose of COVID-19. It typically is more common in younger people who have a strong immune system, and typically more common after your second dose as well. So what is this? This is basically your body learning to fight off COVID. So when you are ever exposed to the virus in the future, your body says, hey, I recognize that. I know what that is, and I'm ready to fight it off. So you can think about those symptoms or side effects after you get the vaccine as priming the pump. It's making your body ready to fight that virus if you were ever exposed to it. So you can expect to have those short-term side effects from the vaccine. And you can think about it as, okay, I'm going to go through that, but it will prevent me from being hospitalized. It'll prevent me from dying. And it's going to likely prevent me from having these long haul COVID effects that I'm not going to receive the disease itself.
Perfect.
Can I add to that? Because I'll share that this very conversation, I mean, even the analogy that they used about priming the pump, I literally said those same exact words today. I lost track of how many times I've had this very conversation. And one thing that I think about when it comes to the long hauler syndrome is what we call it, when a patient who has recovered from COVID but is still experiencing very much so the residual impact of that virus on their bodies that we are still learning what to do with, right? Let me just be honest. In medicine, we do not have all the answers, right? We do not know everything. And so we're working with the specialist, the pulmonologist, to try to support the patients who have experienced this and still figuring out how to support them in ways that impact them in holistic ways. The other thing that I hear patients sometimes saying is that I just want to get the COVID, that's what they call it, the COVID, and just get it over with. But you never hear a patient who actually had COVID say anything like that, because those patients are clear that they don't want anything to do with it, right? Because they remember what they went through. And I every day have patients who 4 and 5 months later still have distortions in their taste, because we talk about the loss of sense of smell and taste, but even after they move through the process and as it's coming back, it's distorted. So foods that they used to love to eat or enjoy don't taste the same. And for lots of my patients, they love to eat. And so that is one of the most annoying things for them. And that's not to mention, the 82 and 84-year-old couple that I just seen who is going to see a pulmonologist because they cannot stop coughing, and it's 4 months later. And so one of the motivational tools that I try to use for patients is like, listen, this is important. Get the vaccine because you don't want no part in any of that. You don't want it. And if we can do something to prevent that from being your story, because once you walk down that path, I don't have a magic bullet. I don't have a magic pill to make all that just go away. But I can expose you to this opportunity to prevent that from happening. And so that's another tool of insight that we try to use in this space to encourage patients to do the thing that's best for them to protect themselves from any of these long hauler symptoms.
Thank you very much, Doc. I'd be remiss, you can see Pastor Wine has to leave us. He's got to go down to the ER to check on our friend, Carrie Whitfield and other folks. And then Dr. Talia Phillips, I really do appreciate your insights as well, as you have other clinical things that you have to attend to this evening. And both a man of the cloth and a doctor's work is never done. So I appreciate your attendance, and we'll continue taking questions and things of that nature as you two step out. One of my last questions of the evening is, how the vaccine can help us return to normal more quickly. If, you hear two sides of the argument, there won't be the same normal, and there may be a new normal, but in your opinion, panelists, how can that get us to some semblance of normality quickly?
Eric, I would just highlight that we've seen a dramatic decline over the last several weeks in the number of new cases of COVID. And unlike previous peaks that we've seen during this pandemic, that decline is because of the vaccine being given in our community. As we think back to the peak that we had early a year ago, and then again in November, that got better when we shut things back down. We stopped, seeing people in person. We doubled down on all the masking and had to be very, very restrictive about what we were able to do. And that was the right thing to do to keep our community safe. But the fact that we see cases falling now is because of the vaccine. And so that's a strong testament to why we should continue that momentum that we have. And as many of the panelists have said, this is our opportunity. We didn't have that opportunity a year ago. We didn't have that opportunity in November, but we have it now. And so encouraging everyone in our community, the vaccine is how we keep that trend going down, while at the same time, we're able to get back to doing many of the things that we did before the pandemic.
Yeah, Eric, I would say, for over a year now, particularly in public health, particularly in medicine, we've had to tell people what you cannot do to protect yourself and to protect your family. And now, since the advent of vaccines and the evidence that's come out to support how safe and how effective they are, I've been encouraging, and I really encourage everybody who is on this panel and in attendance to frame the discussion of what you can do now once you are fully vaccinated. And that's the ticket back to normal. And it depends on who we're talking to, who you are talking to. So for example, for my grandmother and my parents who are at higher risk for severe disease, the motivation obviously for them was, well, I don't want to be hospitalized and I don't want to die. And I also want to see my grandkids. Those messages resonate with that population. The challenge now are younger folks, younger populations who are at low risk for severe disease, low risk for hospitalization. So the message needs to be different for this group, whether you're in your 20s or whether now you're in teens. And we can talk more about that. And the motivation now that we can begin to talk about of returning to this sense of normal is keeping our kids in school. Once our kids are fully vaccinated, 12 plus now and up for those who have for the Pfizer vaccine, 18 and plus for those for Moderna and the Janssen vaccine, you no longer have to quarantine if you are exposed to the virus. You don't have to miss school. You don't have to miss graduation. You don't have to miss that key sporting event. You don't have to be afraid of going to your sister's wedding. I really want to emphasize that's the key to returning to a sense of normal and getting to back to the sense of doing things we normally like to do, whether it's going out to a restaurant and not being in fear about your neighbor as well, or with your family, or being around someone who does not have a normal immune system. Travel is another one. When you are fully vaccinated, you don't no longer have to think about quarantining after going to and from one place within the United States, or being tested, for example, before you leave. The United States does require one test that's negative prior to return to the United States if you do international travel, but that being that fully vaccinated gives you that sense of freedom. Freedom in the sense that not having to worry anymore about getting sick. So I really encourage thinking about, which population that we are engaging. Again, older folks, severe underlying medical conditions, younger folks and communicating in that sense. I think that's the next step and the challenge that we all face in the next several months.
Excellent.
We do have a question, Eric, in the chat that if possible, I'd like to get out there because it sort of piggybacks on something Dr. Nettleton said. What is the effect if a person only gets one shot? And what is the impact if a person gets more than the recommended dose? Some people are worried about the small chance of getting too much vaccine.
Well, I guess I can try to take that on. So just to be clear, the Pfizer and the Moderna vaccines require two doses of the vaccine. The Pfizer is a minimum of 21 days apart. The Moderna is 28 days apart. The Janssen vaccine just requires one dose, and then you are considered fully vaccinated. So those are the three different vaccines. Now, for example, the Pfizer vaccine, off the top of my head, for the first dose, effectiveness, and I can't remember the population off the top of my head, but hovers around 66% effectiveness. Once you receive that second dose, then you boost it up near about 95%. And so that's the difference. And again, for public health purposes, we make decisions and recommendations will be made based on a person being fully vaccinated. So the question about impact of more than the recommended dose, I'm not sure how to answer that one. I would say that, both, in our healthcare systems and our public health departments, have confidence in your public health nursing staff, in your medical staff at your hospitals, at your family doctor and your pharmacist, the people who are storing the vaccine, handling the vaccine, and administrating the vaccine are healthcare professionals. Now, if on a very rare chance that an additional vaccine is given, it would depend, but I don't see an adverse effect with that regard, except for anticipating perhaps additional, more robust immune response. But again, I would have confidence in your public health and your medical and pharmacy staff.
Second question, is it proven that if a person has COVID and they also receive the vaccines, both doses, that they will not get COVID again?
So I think there are a couple questions
It's a little loaded one.
Well, there's a couple different layers there. So let's talk about a person who has had COVID, but has never received the vaccine. The Centers for Disease Control and Prevention estimates that that person probably has somewhere in the immunity for about 90 days after they are recovered from their illness. And that's based on other types of coronavirus in the past, other types of respiratory illness, and also with the virus that causes COVID-19. However, I recommend, as does the CDC, for people who have had COVID in the past to get vaccinated, because we don't know how long that so-called natural immunity lasts. And we recommend that person get vaccinated to have that full assurance that they will be more fully protected from getting COVID-19. Now there are these questions about so-called breakthrough cases. This is the so-called, hey, this person actually was fully vaccinated more than 2 weeks after their second dose. You hear about this in the news, and they'll say hundreds of cases. I think what's oftentimes left out of that conversation is the following, is one, we expect this to happen. We expect that some people would still get COVID-19, but these people aren't hospitalized oftentimes, and they're not dead. And if they do get sick, it's a much more mild illness. This is true of all vaccines as well. And also times that what's left out of that conversation is the denominator. You hear about, well, these are hundreds of cases. Well, the denominator is millions out of millions of people who have been vaccinated. So then we're talking about numbers like 0.01% out of all those who've been fully vaccinated who end up actually getting sick. And so those are the two things that I communicate when those questions come up. Now, part of our public health system for sure is to investigate those cases. That's what we do in public health. we do want to know about this in case something else new is happening. Another important reason to vaccinate as many people as we can is to prevent these so-called variants from doing new things. And so that's part of our public health surveillance, is to investigate these cases, make sure that nothing new is emerging in our community or in other parts of the world. I hope that answers the question.
There was a follow-up question about, can they still be carriers? Which again, I think might be a little bit of a loaded question.
Well, this is a really excellent question too, and I'm talking a lot, so Dr. Lane Davies or anyone else can chime in as well. But, and so the questions that were asked in the clinical trials, for example, for Janssen, Moderna, Pfizer, for adults 16 and plus, was, do these vaccines prevent severe disease? Do these vaccines prevent hospitalizations? Do these vaccines prevent death? The answer to those questions are yes. That's what these vaccines do. And so that the finer point is, well, do these vaccines interrupt the spread of disease? That's not the question that was asked in the clinical trials. And that's what these things are called, evidence-based medicine. However, how we practice medicine, how we practice public health is also based on our experience as well. And our experience is wide with vaccines. And our experience now is wide also with the spread of COVID-19. And our experience tells us, with our medical and public health expertise, that these vaccines do reduce the spread of COVID-19. And that's also the justification for those who are fully vaccinated to not wear masks as well, particularly when they're around others who are fully vaccinated.
Any other questions, Carla?
Yes, and I think you mentioned it earlier, but it might be good to reiterate in case someone mentioned it. Is it possible that we will need a booster soon to address the variants?
Excellent question as well. You know, I don't anticipate that for the year of 2021. And I don't want to confuse the differences between different types of virus. For example, the SARS-CoV-2, the virus that causes COVID-19, and influenza. And there are different types of influenza, or the flu, that you think about are updated every year because the influenza virus changes. Now, I'm not a virologist to go down the differences there, but I would anticipate that eventually the scientists will be doing these type of investigations for these type of updates, because things change over time and they change rapidly, particularly with viruses, and particularly with RNA viruses like the virus that causes COVID-19. So I anticipate those things, and we'll be hearing more from those scientists. And that's where it's great about the scientific field. Everyone has their bit of expertise, whether it's the scientists who develop the vaccines, the medical professionals who care for those who have COVID-19, and the public health professionals who think about how this affects an entire community or population. We all work together to protect our families and also our country.
And to circle back to the first thing Eric said, because I think this is maybe as a good question for prior to your wrap up, Eric, is questioning, did I hear you say that if you have had the vaccine, you do not need to wear a mask when out in public?
So to clarify, the CDC had that new endorsement coming out this afternoon. And it really, what it does is saying, when you are fully vaccinated, you are 2 weeks after your final dose of vaccine, that you can be assured that you don't need to wear your mask. However, in the state of Michigan, as of 8 p.m. on May 13th, 2021, there is a state of Michigan epidemic order to continue to wear masks. And again, this is different, and there will be further guidance coming out from the state of Michigan, I anticipate very, very shortly. And this is also specific for non-healthcare settings. And so I anticipate when I'm in a healthcare setting taking care of people, I'm still going to be wearing my mask. There's further guidance coming about that as well. I see Dr. Lane Davies is unmuted.
Well, and I would just highlight again that exception that the CDC is making is for people who have been fully vaccinated. And so we know that people in that group are much better protected than those who have not been vaccinated. So it is yet, regardless of how it filters down, from the federal to the state level, the value in being vaccinated is clear in allowing us to get back to living our lives in a more normal way.
Thank you both. And I'm glad we cleared that up, because that's the second question where somebody in this room said Eric said, and I am not an expert, but it's good we're having these conversations, because you can see how easy it is to get kind of crossed up just using common words and what have you. Dr. Nettleton mentioned that although he is not a virologist, I know somewhere that they have virologists, I would assume, and that's Pfizer. And so, Melissa, I want to get you back into this conversation around boosters and the science and things of that nature. Is Pfizer actively either concerned about these variants or making adjustments or addressing the science behind where we need to go next? I'm asking inside questions while I got you here. So
absolutely, Eric. So we are always concerned about variants, but we have seen that our vaccine is effective against the variants that are out there. We are in discussions with the CDC, FDA in regards to a booster. But I think that Dr. Nettleton is right that you won't see a booster in 20. This is Melissa saying this in 2021. But certainly our scientists are working on that in line with the federal authorities. So I definitely can say that that is the case that we are working on.
thank you very much. Look, now, as we're coming to a close here, I've been instructed to mention that, we want to provide a call of action to everyone, folks that are either in this forum, whether it's Facebook Live or on Zoom, to become an ambassador to talk about the vaccine, and to sign up today to do that. We'll have a training next week on May 18th at noon and 6. All you have to do is just email Angela at bccfoundation.org. You see it right here, and to sign up. And this is the flyer right here. And of course, this is being recorded, and we'll have access to that, and we'll get you what you need to be an ambassador. I also got a little note while we were talking that our friend Kerry Whitfield is out of the hospital. He yeah, and he was putting up a fight. He's not gonna let COVID. Okay, they wouldn't let him leave, and he was negotiating, trying to get out of there. So, but I'm happy to hear that. It's obvious that our prayers worked for Kerry, and we'll continue to do so for those that aren't here any longer, and those that are struggling with COVID going forward. But this has been a great conversation about the risks and rewards of the COVID-19 vaccination. It's been very educational for me, and we're very fortunate to have such an expert group join us for the discussion tonight. What I'll do is I'll go back to our panel. Are there any parting words that you have for our forum today? We'll start with you, Melissa.
Thank you, Eric. What I would say is, thank you for having me back. This is Pfizer's second time doing the panel with the NAACP. We will come back as many times as you want us to. Again, I just want to thank Michigan because, again, the vaccine is being made right there in Michigan. So thank you, and thank you for the support of Pfizer. I continue to urge everyone to get the facts, to get vaccinated. And if you talk to your family, talk to your friends, and take them to the pharmacist to get vaccinated, because we can prevent death by getting vaccinated. We can get back to normal by getting vaccinated. So thank you for the opportunity.
Thank you. Dr. Davies?
Thanks, Eric. So as a pediatrician, I would be remiss to not really elevate the importance of children in our community being vaccinated. So great news this week that the Pfizer vaccine has been approved for children 12 and up. I've looked at all this data extensively, and this vaccine is incredibly safe and incredibly effective in children. And my team is taking care of children here in our community with COVID and the secondary effects of COVID, and several of those children have life-threatening illnesses. So even though that is rare, the benefits to children getting the vaccine are greater than the risks. And it's a really important way for stopping the broader spread in our community.
And Dr. Nettleton?
Well, thank you so much for the opportunity to be here. I really think about where we're at in terms of our county and our community in protecting the entire community. And this has been a marathon for our community, for those on the front line. And to be frank, the end of the marathon is uphill. We got a ways to go in Calhoun County to kind of reach, a goal of 70% of our community to vaccinate for those who are eligible. And it's going to take these conversations. It's going to be taking those conversations with your doctor, your family doctor, your pediatrician, thinking about ways we can support them in the community to begin vaccinating where people are the most comfortable, whether it's in their own primary care clinic, whether it's in your church community, as we've done here in Calhoun County, and do so in the future. How do we meet kids where they're at, where they're comfortably be vaccinated, whether it's at their doctor's office or at their school environment? These are the challenges, particularly moving into the fall. And I really placed what Dr. Lane Davies has said. What we really want our kids to stay in school. We really want our kids to participate in sports. And to do so, that return to normalcy is getting them vaccinated. And so we have about a month left in the school year where folks are actively in school to get them vaccinated. And then begin the plans for the fall, and ideally to get these kids vaccinated prior to school starting, so we can maintain that core function of being a community and our kids being educated and staying in school instead of being at home in quarantine or away from a sport and athletic that they love. That is really the challenge for our community too, moving forward and into the fall of this year. And we can do it. It's these partnerships that we're having here today and these discussions today that will get us there.
Great. I want to again thank you all for your participation. Your words are, 1, very thoughtful, 2, very educational, and 3, very necessary for the time that we're in right now. What I'll do is, Carla, is there anything that we need to do to clean up before we exit tonight?
No, I think we were able to answer the questions in chat. I would also let you know that we did put some different links in the chat for people about upcoming clinics and different things like that. So hopefully that'll be useful to folks. We will make this recording available on several Facebook sites in its entirety. And so if you want to share it from there, you'll be able to do that as well. Just a thank you to all of the various partners. And I'll be bold and say I won't say it as eloquently, but on behalf of Mr. Whitfield, he is so appreciative of the partnerships and the passion and the commitment of all of you to this effort and helping him get this message out. I know we would not have survived in the mid part of the pandemic without Carrie's work and the work of the NAACP. So a shout out to him, but also to each of you for your role in this.
So, and Angela, did you want to add anything before we exit?
Yeah, thank you so much, everyone, for participating. And if you need anything or you're looking for how can I get further involved, please feel free to email me and I can get you connected or talk to you about what you might need in the populations that you're serving. So, and I know Rod is also a great resource for Albion, for the Albion folks, but we're both here to help. So my email's been in there a couple times, but it's angela@bccfoundation.org, and please feel free to reach out.
And I will leave, I would like to ask for our parting words to be by the esteemed president from Albion, Bob Dunklin. If you will take us out, Bob, you can even shout what's the motto? The biggest, the baddest?
The biggest, the baddest, the boldest, the oldest.
You
So
got it.
what I'd just like to say, civil rights organization in the country. But Erica, I would just like to thank you for moderating this discussion. You did a great job. And to all of the participants and all of those who log on to gather more information, I hope we can just carry this information and share within our community, and maybe help someone who just need just to hear a little bit more before they get that vaccine, because I think it's important. If we want to get to that 70%, we all have to participate, all of us. So to all of you, thank you. Have a great night.
Thank you all. Stay safe.
Thank you.